Good afternoon, and thank you very much for having me here. I'm a community pharmacist working in my own community for around 30 years. I work in a low to middle income community in an area called the Durban South Basin in South Africa. I have a super team of healthcare professionals working with me at the pharmacy. And we have been performing various tasks related to pharmacy itself, which most people are familiar with, around medicine supply and management. Outside of that, we perform a whole series of activities around primary healthcare that keeps that community well.
Thank you. And can you say something about how community health is organized in your country?
Yeah, so we have a dual system, unfortunately, of healthcare. One is a private paying patient, mostly paying through an insurance program, but majority of our population is managed via a state-funded program of primary healthcare. But in private sector where I work, a lot of activities crossover, where we see approximately 30% of our patients come through out-of-pocket payment. So that's the dual system we have. But we're working towards universal health coverage. And in South Africa, the target is to have a national health insurance program in place within the next few years.
Okay, wow. And what have you learned in the past few years about community health and resilience?
Well, I think the major change that has occurred around community health is the pandemic, unfortunately. And what it has shown us is that, one, it is impossible for any system to cope without the inclusion of every healthcare professional in a country. I think this pandemic has allowed for massive collaboration across sectors, whether it's the GP network, specialists, hospitals, or nurses at a community level, and most importantly, the community pharmacy. We have been probably across the world one of the few healthcare professionals that were able to stay open long hours through the pandemic, and probably the only port of call in many communities for health services. So based on that, I think the world is probably now re-looking at what pharmacy can do as a profession. And there's been, out of the pandemic, an extended scope of practice. And I think this will probably become a norm across the world, that services that pharmacists were not able to perform previously are continued to be done post the pandemic. A good example would be obviously the vaccine program. Previously, you needed a prescription to administer a vaccine, but with the COVID-19 pandemic, COVID vaccines were administered in South Africa, for example. Community pharmacy administered approximately 7 million vaccines up to this point. And I think that will continue to exist going into the future, with not only the COVID vaccines, but with other vaccines. And we've been doing the flu vaccines, for example, over the years as well.
Yeah. Okay, thank you. What role do you think can community health workers play to improve resilience in communities in times of crisis? You already mentioned an example, but maybe.
Yeah, I think the most important issue is to create a network of trust within a community, and to be able to provide the necessary resources for that community in times of difficulty. I think what we've learned out of the pandemic is that the communities have really taken a battering in terms of mental health, in terms of loss of family members, and the support that healthcare professionals, healthcare community workers can provide, that resource is invaluable in terms of any type of crisis. So I think in building this resilience in communities, this structure needs to exist. We need to create trust, and we need to create that network that interacts with the community. I think that's the most important thing. What we've been managed to do within our own community, for example, is to set up that network of healthcare professionals, whether it be the local GP, the optician, the nurse, the dentist, the pharmacist, and we managed to work very closely together to provide that support mechanism, including creating a network that allowed patients to pick up the phone or interact virtually with any of the healthcare professionals listed to seek services, referring amongst each other so that whatever resources that community needed was provided for during that time.
Yeah. How would you describe your community where you work?
It's a low-income community in an area that a lot of patients are dependent on public health. Outside of that, there are some part of that population that's insured. But I think over the years, many have lost their jobs because of the economic issues. So healthcare really has become a focus area for many of them, in the fact that they struggle with mental health issues because of loss of income, family issues related to deaths via the pandemic. So that community is very reliant on local health services. And I think our healthcare professionals and healthcare workers within that community have been a huge source of comfort for them.
Okay. Thank you. And my final question is, as an experienced community health worker, what advice would you give to the future generation of community health workers?
I think working with communities is really a fulfilling task. It's what you train for as a healthcare professional, as a healthcare worker. And I think it's hugely rewarding. Many healthcare professionals and healthcare workers do it for the love of people. And I think working within communities provides that level of satisfaction that you can't get in many other types of industry. It's rewarding in that when you see a child get better, or you see somebody with chronic conditions are stabilized and kept well in a community. Those are some of the achievements that you are able to brag about as a healthcare professional later on in your career. So if you're choosing this path, one of the things is to connect with your community, become part of that community, and live amongst them so that you understand what their needs are and are able to provide for that.
Okay, thank you very much for your time.
Thanks for having me.